Osler. We're coming to the end of our first week to our trip to Punjab, India. Today we visited a village, Chakar, an hour and a half outside of Ludhiana. It's the first modern village that we know of actually in Punjab. We had a very interesting excursion, learned a lot today. I'm going to turn it over to David, Dr. Kozaczynski, to let us know a little bit about his thoughts of the day.
Truly fascinating day, I thought. We were greatly welcomed into this village. They had tremendous pride, didn't they? Tremendous pride in what they've been able to create. We have heard a lot over the last number of days about some of these socio-cultural, economic underpinnings of challenges in the provision of healthcare. And I was truly impressed with what they've been able to create in this community, which is quite unique from other villages, and to try to address some of those economic and social factors that underpin the early onset of disease occurrence.
Mm-hmm. And what was really fascinating for us is the advanced sewage system that had been developed by this community. Not just sanitation, but fresh water to ensure they have clean water for their village, which consists of 10,000 people at this point in time. And this is quite different from the other villages that we've seen in India. As well, what they've developed in their infrastructure, they have a I will say it's not a soccer academy. Help me out here, Dave.
Sports complex.
Sports complex, that's the word. They've got a sports complex where they expect their children to spend 2 hours every morning and 2 hours every evening, and dedicated to a sport of their choice. There's also a little hospital or clinic. Hospital would be too big of a word, wouldn't it, David? But a small clinic where the villagers can receive treatment and care for some essentially primary care type of entities. But as well, what struck us, as we've learned here in India, that about 1.5% of funding comes from the government towards healthcare, whereas in Canada, or actually Ontario specifically, 67% of funds are publicly devoted to healthcare. But we learned a lot about the needs in the social infrastructure here in India.
Yes, absolutely. They have been able to increase accessibility towards healthcare by having this primary care physician who had the privilege of being able to meet and speak, who is embedded within their community. He doesn't have access to laboratory services. People have to travel outside of that, but it is a great advantage over neighboring communities. We've also heard an awful lot about the incidence of addictions in the very young age group, particularly the young boys within communities in India. And as you spoke of this tremendous emphasis on sports and teams, and they spoke with great pride of some of the success that they've had in mentorship for these early adolescents, tremendous reduction in the incidence of addictions within this community compared to other local communities. Again, a true model for what can be accomplished with this sort of investment in communities and villages. I think we would agree that the emphasis on early prevention, the emphasis on primary care, early detection of illness is something that other areas, other communities can learn an awful lot about. I think that there still is a lot of room for improvement in terms of accessibility amongst the various socioeconomic layers and classes within India, individuals who have diagnoses of cancers and other chronic illnesses sometimes simply can't afford treatment. And I think for all of us, we find that to be somewhat heartbreaking. Mm-hmm. Again, it really emphasizes the social, cultural, and economic underpinnings of illness that has been a tremendous education for us as we've come to India.
So it's one village's approach to fighting some chronic disease, one step at a time.
Absolutely. So we are very much looking forward to taking this to the next level and being able to link with healthcare providers and hospitals within India to see how we can help and how we can learn. We've certainly learned an awful lot.